One way to dramatically improve your communication and leadership skills is by explaining things simply to people. And one way to do that is to use visual process models. This could range from drawing something out on a whiteboard to having something graphically designed. And what you're trying to do is take complex situations and boil them down to a little line graph or a little image of some sort that when you present it to other people, they don't get lost into 500 details, but the key idea is packaged in such a way that it makes sense for them and they can concentrate on what really matters. Some of the main reasons I like these models are because it simplifies complex problems. You can summarize the majority of your situation or challenge with a little model. You can help people think visually, which they do naturally more than words or auditory, so drawing something really helps them. It allows you to stand out, especially if you create unique models that are customized and nobody else has them versus uses standard 2x2 graphs and so forth. A 2x2 graph would be like a SWOT analysis, strengths versus weaknesses, internal, external. And so strengths would be internal, positive, opportunities would be external, positive, and then the negatives would be, weaknesses would be internal, negative, and threats would be external, negative. So even though that's a nice square box and out there widely in the world and a favorite of many marketing and business professionals, coming up with something unique or a little bit different is sometimes much more impactful. A couple other positives I like about them. It gives you something to refer to periodically, to go back and talk about, helps everybody keep on the same page. Now, one of the things is these aren't easy to create, and so you really got to think through them and go through iterations and so forth and look for inspiration. But once you get them and you can draw them out, maybe get the help of a graphic designer, you can really create some interesting, unique perspectives on these. And then what I like to do is whenever I see a good one, I keep files of these. I have booklets, pages, this sort of thing. And then you can even include them in war rooms or presentations or other places where you're going to be meeting with people and use them to make your situation more effective. One of my favorite books that I spent a couple $100 on a few years ago was written by Alan Weiss, who's a consultant. And it was a simple paper-bound book similar to this, but it has 50 visual process models in it that he used and he put together as a book. And so a lot of times I'll start with this and see is there something that I could modify. For example, here's a process diagram that he would have created with different steps and so forth. Whether I use these categories or modify them or whatever, I'm looking for the idea. And in addition to this book and many other sources, I just keep samples of these as kind of a way to brainstorm potential models once I need one. Let's go through a few examples that I've used throughout consulting situations that may be helpful to further explain this process of what I mean by a customized model. This first one was done for a foundation. A foundation is a place where you give money. If it's a community foundation, you set up a fund, they invest that money, and then you take the earnings from those investments and give them to other charities. So if you'll think of things like the Bill and Melinda Gates Foundation, that's their own foundation where they would have their own staff and so forth, but they're going to sponsor a number of organizations or causes and this sort of thing. So as you become more successful, you may set up your own foundation. Now, one of the things that the organization was thinking of was that although people had put their money into the foundation, the board was thinking, we'd like to spend things on what we want, not on what the individuals want per se. And so we ran all these focus groups and talked to all of these people, and I put a report together, and in the middle of the report it had this model. And the board president asked me, would you give a presentation to the whole board? And when you do, just show this one slide. I said, why do you only want the one slide? He said, because this slide has effectively articulated what our challenge is. We kind of were mishing and mashing around it. We didn't get to it. It very simply describes what's going on. Here's the model. And notice it has 3 levels. There's direct donation, which means you as a donor would give money exactly to the different charities that you wanted. You'd write one check or make one donation at a time. Then there's donor directed, where you'd write a check to the foundation, and then the foundation would write the individual checks for you to the different organizations, but you still control it. And then there's board directed. And what happened is now the foundation becomes the charity, and the board or the foundation decides where the money's going to go. And so what this clearly showed was that when people set up a fund with this foundation, they were thinking of the foundation more as their back office. In fact, I heard that in the focus groups we were running, as some of the people described what they thought the foundation was doing for them. And so that's where, even though they gave their money away and it's no longer their money, they still had great control over where everything was going. So if they liked cats and dogs, they could write checks to animal charities. If they liked education, they could write them to education. But when we thought about the board directed, they basically lost control and they had no idea of where their money was going. It might or it might not reach their target audience. And so this graph very systematically crystallized what the challenge was that this organization was up against. And that's why it was so effective and why the board director only wanted this slide presented at the meeting. This model was created for a company that sold dental insurance. And they were trying to figure out how to get people to change their dental insurance. And what it struck me at the end was that this was a lot like a soccer game, that several things had to happen in order for somebody to get a shot on goal. And in this case, what were the things? The person throwing the ball in, they had to have that was the company. They throw the ball in. Then they'd have a broker or consultant would have to recommend them. That was one person would kick the ball. They'd pass it then to a second player. In this case, it was employees who had complaints about the existing carrier. Then they'd pass to somebody else, and that carrier had substantial price increases. If they did all of that, then the company was willing to allow somebody else to come in there and give a recommendation for offering insurance to their employees. So it was a soccer game, if you will. Now, this is not the whole report, of course. It's just one example. But this little soccer game very clearly articulated the challenge that has to happen for this company to be successful. Here's a model I made up called apostle marketing. It's basically viral marketing. But what it was early on in the internet days, there was a religious organization that wanted to be basically an auction or a clearinghouse where they would sell church pews or books from one to another organization. So a marketplace basically for religious organizations. My boss at the time didn't want me to use this. But what it seemed like to me from the research was that the best way to sell this was when other people talked to other people about how great it was. And so if you'll think back to most religions, they have a leader and then they get apostles, which are followers. And then those apostles go out and they get other people to follow them. And that's how it spreads. So we built this little graphic and I called it apostle marketing. I used it in my presentation. It worked great. The client loved it. It fit with their priorities. I've never used it since, but it's an example of a customized model in a specific situation. Here's an example of a model that I used to help two competing health systems merge. They were in a small town and they'd already merged a few things, but it was going very, very badly. And the executives were being blamed for trying to make more money and drive around in fancy cars and sit at nice desks. And it was just getting horrible and not going anywhere. So again, we ran all sorts of surveys and focus groups. And I was actually in church one day in the cry room. My children were young. And wouldn't you know, the sermon was so boring that I started daydreaming about Luke Skywalker from Star Wars. And there's a scene in one of the Star Wars ones where he's fighting with the enemy there, and he jumps into a trash chute and goes down, and then all of a sudden the trash chute, he's going to get strangled by a snake or something, whatever is in the garbage there, and then the walls start pushing in on him. And I thought, wait a minute. That's exactly what's happening with this healthcare organization. We have two competing health systems. There's not enough room for either one of them to survive or both of them to survive by themselves, so they have to merge. And what we need to do is blame not ourselves. We need to put the enemy outside our camp, not inside. It's not the executives. It's things we heard in the focus groups like insurance companies, competition, a changing population, government regulations. These were nasty, scary things to people. And so what we did was we went and we presented all the research and the recommendations and whatever to the executives. And I had this thing on a chart blown up, sitting on an easel. It was covered up. I turned it over and I showed it to the executive and I said, so everything we're talking about comes down to this model. What we have to do is start shifting the message to these external factors. That's why we're merging. You have to say it's because of the changing population or the competition or whatever it's going to be. All the messaging needs to be around that. As you might suspect, that was very effective. They actually changed the messaging and the hospital successfully merged. In fact, we won a major award, industry award, for this project. But it was this model that really helped convince the executives and simplified what they needed to do. The print on this model might be a little bit small, but it's basically the process that someone goes through to decide whether or not they're going to do cosmetic surgery. And this came from a bunch of interviews and focus groups, primarily with women. And what we discovered was that during important life events like your child's going to get married or on decade type birthdays, a lot of women start thinking about cosmetic surgery, but they eventually run into a wall and they fall out. If they do decide to go to cosmetic surgery, it usually starts with Botox. If the company, or in this case the physician's office, could convince somebody that they should get Botox to get rid of some of the wrinkles on their forehead or somewhere else, then they were much more likely to eventually go through a facelift or some sort of major surgery. So there was a whole process to it. We basically used this to summarize all of the thinking and decisions, and then put it on a big poster, framed it, and gave it to our client, and they put it in their marketing department and would use it frequently to talk about what's the whole process they need to be going through, what do they need to be thinking about, why, and so forth. So a diagram of the thinking process of their customers. This last one is a nice little circle model where you run the circle and say, hey, we're too focused on the inside. We need to be focused on the outside. And so this was actually done for billing, hospital billing. And one of the things were the internal improvements, or in this case, the purple line. They had come up with a new bill format and they were all proud of it. And so it had combined bills, they redesigned the layout, they had due dates, there was glossary of terms on the back, they listing specific doctors and hospital services. All that's great. What did the people really want? So we had talked to patients in focus groups to ask them what they thought about their bills and what they wanted in it. They wanted to see things like unique account numbers for each patient on there. They wanted more complete descriptions of the specific services provided, not just the physician. They wanted an easy match code glossary term index, one of the ways to further look up information. They want a list of the patient's insurance portions on the bill so they knew what was being paid by what, when, why. They wanted to benchmark other health systems bills to identify best practices. So this is a real nice model where, hey, we're too focused on the inside. We need to get focused on the outside. Two circles with arrows pushing the second arrow toward the outside to move the organization down the road. It's a nice little model that can be used to summarize situations. So whether you use one of these models or an existing one you find in a book, either way, I'd say try to make it as customized as you can. Try not to make it too complex, but it's a great way to really simplify what it is you're trying to communicate. And so if you get good at this and you get a good design going, you can dramatically improve your impact. So think about using models next time you have a complex situation you're trying to explain to people.